Assalamualaikum warahmatullahi wabarakatuh and greetings to the lecturer. So for today, our groups are going to be presenting about Apert syndrome, or also referred as acrocephalosyndactyly. Apert syndrome is a genetically inherited condition that is marked by craniosynostosis, which is the premature fusion of the coronal suture in the skull. So this fusion leads to a noticeable facial and skull deformities, as well as syndactyly, which is the condition where the finger or toes are fused together. In individuals with Apert syndrome, we often see distinct malformations involving the skull, face, hands, and feet, which are the characteristics of this rare syndrome. With this overview of this syndrome, we will now move on to the causes of this rare syndrome.
Next, I will be discussing the genetic causes of Apert syndrome, which is premature fusion of bones in the skull, hands, and feet. Let me explain more in detail to understand this syndrome. The FGFR2 gene stands for fibroblast growth protein receptor 2. This gene provides instruction for making a protein that plays a crucial role in bone development. Specifically, this protein is responsible for signaling immature cells to develop into bone cells. During normal prenatal development, FGFR2 ensures that bone grow and fuse at the appropriate time, allowing for proper growth and formation of the body. However, in Apert syndrome, a mutation occurs in FGFR2 gene. The effect of the mutation alters the protein by increasing the signaling activity. As a result, the abnormal signaling causes cells to mature too quickly into bone cells. Eventually, bones started to fuse prematurely that promotes premature fusion of the bones. In Apert syndrome, the FGFR2 mutation causes the premature development of skull bones, a condition known as craniosynostosis. This causes of head an abnormal shape, which in some cases does not effectively provide enough space for the brain to grow. The same mutation also causes premature fusion in the hands or feet, leading to synodactyl, which fingers or toes are fused together. Complex syndrome occurs as part of Apert syndromes, often requires surgery to improve function and appearances. To summarize, this mutation of gene can lead to premature fusion of bone in the skulls, hands, and feet. Understanding the concept of genetic mechanism is important for diagnosis and developing effective treatment to improve individuals with Apert syndrome quality of life.
Symptoms of Apert syndrome. The first symptom is premature skull features. It is also known as craniosynostosis. The head is unable to grow normally due to early closure of sutures between bones of the skull, because normally the sutures remain open in early childhood for the development of brain. The premature fusion results in the noticeable ridge along suture where the bone has fused, and also it is occurred due to large or late closing soft spot on a baby skull. The second symptom in facial appearance, it has a sunken appearance in the middle of the face, bulging and wide set eyes, a beaked nose, and shallow eye socket, which can cause vision problems. The third symptoms, in hand and feet, it causes whip or fuse on fingers and toes. 3 digits on each hand and foot are fused together. It called syndactyly. The most severe is the webbing of the second, third, and fourth fingers. It is called mitten hand. And then, the fusion of thumb and fifth finger are sometimes also involved. Other than syndactyly, it may have extra finger or toes that called polydactyly. The fourth symptoms, oral and dental issues. It occurs due to undeveloped of upper jaw, leading to a crowded teeth and dental problem, such as a feeding issue due to the cleft of soft palate. The fifth symptom, frequent ear infection and hearing loss. Hearing loss is common about 80% and is typically conductive, caused by medial ear disease, ossicular abnormalities, and external auditory canal stenosis or atresia. Abnormalities of the semicular canals are found in 70% of affected individuals. The next symptoms is skeletal abnormalities. Due to the alteration in the shoulder, humerus, elbows, hips, knees, ribcage, and spine, except the cervical spine. Lastly is cognitive abilities. Most individuals with Apert syndrome have normal intelligence or mild intellectual disability and moderate to severe intellectual disability in some individuals. Other than the all main symptoms, unusual heavy sweating, hyperhidrosis, oily skin with severe acne, patches of missing hair in the eyebrows, and fusion of spinal bones in the neck also the symptoms of Apert syndrome.
Hi and Assalamualaikum. My name is Siti Aisyah and I'm going to explain the diagnosis for Apert syndrome. Firstly, by performing ultrasound 2D or 3D to the mother, since Apert syndrome can be detected in second and third trimester. Secondly, we have imaging tests like CT scan and MRI to confirm the extent of craniosynostosis and assess fusion of bone in the hand and feet from the fetus. Next, we have genetic testing to detect FGFR2 mutation through chorionic villus sampling. It is usually performed between the 10 and 13 week of pregnancy. There are two techniques for this genetic testing. First, we have transcervical approach. A thin tube is inserted through the cervix to collect the sample, and then secondly, we have transabdominal approach. The thin needle is inserted through the abdominal wall into the placenta to collect the sample. The FGFR2 gene is analyzed to identify mutation associated with Apert syndrome. Some of advantages for doing this genetic testing is we can get early detection since chorionic villus sampling allow for diagnosis earlier in pregnancy than other procedure. For example, amniocentesis. Amniocentesis typically done after 15 weeks of the pregnancy. However, this procedure also have limitation and risk. For the risk, that person could have a miscarriage, infection, cramping, or vaginal spotting after the procedure. For the limitation, this procedure does not detect all genetic disorder. It only focuses on known mutation or specific concern. Other than that, this procedure also cannot provide information about structural abnormality which require us to do ultrasound or other imaging tests. And then, for the afterbirth, we have physical examination to detect the facial abnormalities such as a flat face, wide set eye, and underdeveloped upper jaw. Also, it is also to detect syndactyly fusion of the finger and toes, especially mitten like hand and feet. Lastly, we have developmental assessment. The baby will receive a regular newborn screening with emphasis on a hearing test to check for hearing impairment caused by the condition for Apert syndrome.
Assalamualaikum. My name is Christina Humaira binti Hashim. I will be presenting about the Apert syndrome treatment option. First is face reshaping to correct craniosynostosis. Together, the child pediatrician and the craniofacial specialist will decide on the child's need and identify any therapies that are necessary. The following typical technique performed is to treat the syndrome if surgery is recommended. Second is frontal orbital advancement. Together, the craniofacial surgeon and the pediatric neurosurgeon keep an eye out for any indication of brain exposure. A phase process of scar reshaping is used to increase the volume for the development of the brain. Third is midbrain advancement. The purpose of this surgery is to expand the size of both orbit, meaning the area of skull that houses the eyeball, and the amount of space inside the skull. Fourth is facial bipartition. This is usually performed around age 5 or sooner if breathing difficulties arise. The cheek and lower orbit are advanced. This technique encourages both growth. Even so, it expands the upper jaw, realign the orbit, and contract the upper face. Fifth is hand surgery. Care for the hand and feet start as early as at 2 to 3 months old and is aligned with the care of the toes and feet. The kind of surgery conducted by trained hand surgeon depend on the specific hand abnormality and the child's requirement. Last but not least is osteotomy. It shifts the jawbone of the upper and lower jaw to address additional bite irregularity. Typically, this takes place during adolescence. That's all from us. Thank you.